another engaging session of our scientific forum, Immunize Talks. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one-of-its-kind platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating public about vaccine-preventable diseases and the importance of timely vaccination. This session featured leading experts across the country who share their valuable insight on key health topics aimed to raise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. Saurabh Khanna with us to share his expert perspective on hepatitis A in children, what parents should know. I shall be sharing more about today's speaker in a short while. For the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. It was established in 1982 by the National Dairy Development Board as one of its units and was later incorporated as a company in 1999. HBI was founded in 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. Our first manufacturing facility was set up in Ooty. This facility is one of its kind in India and rolled out the country's first varicella culture rabies vaccine in the year 2000. Today, we are a leader in the ARV segment with presence in around 60 countries. HBI has launched several other vaccines and became a major player in the human vaccine segment. HBI has been a key player of the pentavalent vaccine to the Government of India under its Universal Immunization Program. In yet another milestone, HBI has introduced Habisure in 2024, India's first indigenous hepatitis A vaccine, aimed at providing protection for both children and adults. With the vision of shaping global healthcare by spearheading the One Health initiative and the mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, we are committed to providing affordable, high quality products through continuous technical innovations to meet our customer need. As a market leader, we have taken a significant step towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging for our flagship brand Abairab. As a part of our corporate social responsibility initiatives, we have adopted schools where IIL provide infrastructure support and basic facilities, including assistance with the midday meal program. In association with NDDB through the gift milk program, hundreds of school-going children benefit from daily milk nutrition. We have also donated as a oxygen generation plant to Telangana Institute of Medical Science and Research. These are just the few highlights about IIL. For more information, please visit our website at www.indiaimmune.com. Immunize with Pride is one of a unique initiative which emphasizes that vaccination not only protect individual but also strengthen community immunity. Welcome to today's episode of Immunize Talk. So before I go ahead, I just wanted to show you a small video. So, about our today's speaker, he is Dr. Saurabh Khanna. He has completed his MBBS, DCH, DNB, and FIAP, Neonatology, and he's a director in CK Birla Hospital, Gurugram, and he is based there currently. So, I just wanted to welcome sir. So, good afternoon, sir. Just a minute, sir. Yeah, good afternoon, sir.
Hi, good afternoon. Thank you for the thank you. Good afternoon. I must
Yes.
congratulate you for this very good initiative. I would say so, and I hope this in future also reaches out to the public and gives a good, strong message about the vaccination as well as the preventable diseases in India.
Exactly, sir. And we are also pleased to have you on the platform. So, as our topic, we will begin with the topic. So, hepatitis A in children. So, so for the common person, what is their understanding about hepatitis A?
First of all, let us just focus on the word. So this word is actually hepatitis is made up of two words and they are Greek words. One is hepar, other is itis. So this hepar is, stands for liver, stands for inflammation. So when there is a swelling or inflammation in the liver, it is coined as a term called hepatitis. Now this hepatitis can be due to various reasons. Most commonly, it is because of many infections. It can be because of bacteria, it can be viral, it can be parasitical, it can be because of toxins, it
Hmm.
can be very well known thing about the alcohol leading to hepatitis and all. But when it is caused by the hepatitis A virus, then we call it as a hepatitis A disease. So
Yeah.
that's how it came into the picture. Yeah.
Okay, sir. So, we have heard of children getting jaundice from contaminated water and food. So, have you ever heard about it? Like, what parents should be cautious about?
See, this kind of transmission, which is through contaminated food and water, is in children because of various reasons. They just put their hand inside the mouth, they don't follow the hand hygiene practices very well. We are talking about toddlers in this age group. And among the diseases like typhoid, like gastroenteritis, the hepatitis A virus also spreads through the same route. So that's why
Yeah.
this is a very common thing with the child age group. And as we grow and as we learn about the hand hygiene techniques and sanitization and everything, and these
Yes.
tend to get better.
Okay. So basically,
And
it's
the
spread by
infections,
food
of
and
course, it
water.
is more of,
Yeah.
yeah.
Please go ahead, sir.
So it can lead to diarrhea, it can lead to vomiting, it can lead to jaundice, and so all these diseases which we just mentioned can lead to this issue, which is jaundice in the child age group because of the contaminated food and water.
Okay. So, sir, do you think that hepatitis A is a serious disease in children? Like, how serious it is?
See, this is a very nice way of saying this, I would say, because I would answer is yes and no both.
Okay.
Okay, focus on the why I know is because, and just be aware about the numbers we are going to speak. So, in the age group less than 2 years, 85% of the infections they are asymptomatic or they have a very mild symptom. If we go on to the
Okay.
age group of less than 6 years, more than 70% do not even present with most of the symptoms or very mild symptoms. So that would
Mm-hmm.
say, okay, the disease is, but if you look at the mass scale, then these are the infections which in a child age group, almost 20 to 50 of the fulminant hepatic failure, the liver failure can be caused by hepatitis A virus alone or in conjunction with some other infections. And when we see the adult age group and we are talking about the numbers in India, then
Yeah.
almost around 10 to 15% of the fulminant hepatic failure in adults is
Hmm.
seen because of hepatitis A infection. So that indicates the
Okay.
severity and that answers to the question that it is serious disease, but mostly it is undetected or asymptomatic in the early childhood.
Yes, definitely. So epidemiology is changing. So seriousness of the disease is coming in.
Yeah,
So as you mentioned, by food and water, it gets spread. Like any other means, like hepatitis A can be spread among children.
see the point consider again is that hepatitis A virus only humans are the reservoir. It is
Yeah.
secreted by the infected individual in the feces. If the sanitization goes wrong, if the
Yeah.
hand hygiene goes wrong, then this is the disease spread, which is known as the fecal oral route.
Yeah.
So, and once this route is breached and somebody has not taken about it goes on to the water, it goes on to the surfaces, it goes on to the food, and somebody else gets it through there. So because this virus is something which can remain viable even in the room temperature and on the surfaces for up to 4 hours. So
Yeah.
it means if somebody has touched even the doorknob or the table, okay, in which
Yeah.
have been previously infected or infested by the infected individual, then the other person can acquire it. So that's why the route of transmission is fecal-oral, and yes,
Mhm.
it is very commonly spread through the contaminated food, water surfaces, and that's why comes the role of the transmission in children and then to the adults.
Very wonderfully explained. So, like, we are the reservoir of the spread of the disease, so we have to be a little more cautious about it. So, as we are talking about the spread, like how poor hand hygiene can be a major reason for infection. Can you hear me,
The
sir?
hand hygiene and all these things are the basic.
Yeah, yeah, you can. I
Yeah.
can hear you. Please go
So
ahead.
thing is somebody is not doing. The thing is it has to go on inside the mouth for this to spread or this to cause. The basic thing is the hand. The hand is getting contaminated, and you do not the the overall hand hygiene practices of hand washing before the start of before eating the food or touching the surfaces and putting the hand in the mouth is not being followed properly, then this becomes the main source of infection. So that's why the role of hand hygiene in prevention of all these diseases forms the major basis of prevention. Then
Okay.
comes the role of okay, the if the water is contaminated and this the disease, the hepatitis A virus is a heat sensitive virus, and if you boil the water, of course the virus would be killed. If you clean the surfaces using chlorine and some chlorinated disinfectants, the transmission can be prevented. But again, the basis being the hand hygiene. So that is what it
Yes.
means. The child age group that whenever you are putting the hand in the mouth, at least wash your hands. Do
Yes.
not put in the hand in the mouth unnecessarily. If you just wash your hands before you start eating the food, so forth.
Okay. So, like we usually say that school-going children are at higher risk. So, why it is said so?
I am not able to hear in between. Please, can you repeat the question, please?
So, I'm asking you that we usually hear that school-going children are at higher risk. So, why it is said so?
Hmm. See, the reason being, we start from the preschool time frame. Okay, we know most of the kids, and as we know by now, that most of the individuals, even if the kids are not having the proper symptoms and they are asymptomatic carriers, and by the time they start showing the symptoms, they might already
Yes.
be being transmitting the virus to everyone around. So it is a close knit group. They do not most of the preschool babies, they are not even trained. Their digestion can go wrong. They of course put everything inside the mouth, and if they do not wash hands properly, that becomes a very common source of an epidemic. From one, it can spread to 15 kids around. From that 15 kids, it can spread to their parents as well if they are not vaccinated and they are not immune to it. So that's why school becomes a common source of these things. That is very well valid with the school because then they will be sharing food. If the food is contaminated,
Yes.
they are not washing their hands. Of course, it spreads very very quickly. Okay, the
Definitely.
source of the water by which they are having the water, all of them, it can be contaminated. So the spread is very fast. So that's why the school and these age groups, of course, they are at more vulnerable risk. And then comes the adolescent and the adults, which gets infection because of contaminated food. Okay, if they had the food from outside, which is contaminated, of course, they can get it even after the following the proper hand hygiene techniques.
Sir, as we know, the kids are kids, so they might not follow some of the hand hygiene protocol, or like they might get infected. So, what parents should look as a sign to understand what is hepatitis A, or they should go to a doctor or to consult? What signs they have to observe?
See, first of all, when the hepatitis A happens to a children, and the most of the symptoms remains very non-specific. And non-specific, we mean it can present with fever, it will present with a
Yes.
loss of appetite, it can present with nausea, which is a sensation of vomiting, it can present with vomiting, pain abdomen, it may or may not be associated with diarrhea, and a
Yeah.
general loss of appetite and being unwell, which is the malaise. But after this prodromal symptoms and these non-specific symptoms, there are certain subset of children which can present with jaundice, and
Yeah.
that can happen after 1 week of all these symptoms. So
Okay.
if you know these symptoms, and if you know that there has been an exposure which has happened
Yeah.
because of the outside food, then we can be alerted and we can do certain things to either, of course, to stop the disease spread, as well as to take care of that child by giving some basic treatment. Okay,
Understood.
and once we are into the stage when the jaundice has happened, then we know that it has already been around 1 to 2 weeks of the symptoms, which must be there. And then, in very less number of cases, of course, this jaundice can go bad and lead to a liver failure as well. But by the time the baby and the child develops a jaundice, they already have a very significant loss of appetite. They present with a lot of pain abdomen. They have vomiting, and then the hydration has to be corrected, and the symptomatic treatment has to be given.
Definitely, sir. So I just got a question as you are telling about the science, and so like if are there any cases like without having any symptom, also strong symptom, they might be having hepatitis A?
Yeah, we just discussed about it that nearly almost 70 to 80% of the kids, they do not have any other symptom, because they
Yeah.
just have these symptoms and their body responds very well, and they get better as well. Okay, so
Okay.
these are the only signs that which can be a sign of a normal viral infection as well. A
Yeah.
viral infection usually presents with a lot of body aches, it presents with pain abdomen, it can present with nausea, vomiting, and the fever.
Okay.
So among 4 cases which won't be presenting with any symptoms, there would be 1 case which would be presenting with these symptoms. So it
Okay.
is better, of course, to look for these signs, of course, and then to vaccinate them preemptively so that they never acquire the virus.
Yes. So like boiled water or filtered water, like usually people tend to like this. Does this reduce the risk?
Definitely it does, because I just mentioned before that the virus is a heat sensitive virus.
Yeah.
So if there endemic area, endemic means the hepatitis is prevalent over that area, and somebody has gone on to that area, so it would be important for them to take the boiled water, because might
Yeah.
affect the endemic population there, but for an outsider it becomes. So going to end areas, boiling the water, cooking the food right, of course, practicing the hand hygiene and everything, but boiling is very important, of course, because the water is a contaminated water is one of the source of infections, so it does help.
Yes.
Okay, and it has a significant role in prevention as well.
Okay. So you are practicing, so there might be many parents coming to you with their kids. So what is your perspective like how much awareness is there regarding the vaccination among parents today?
Yeah, see, I'm since practicing in the TAT 3, the society, so we know that most of the parents are educated enough to know what hepatitis A is. And because the Indian Academy of Pediatrics has laid down very beautiful guidelines and the vaccination charts, which
Yes.
simply everyone who is educated would be going through and even asking, okay, what is hepatitis A? But when we see this happening from suppose the child is getting a vaccine from a government hospital, and we know it is still the hepatitis A vaccine is still not there in the government vaccination schedule due to various
Yes.
logistic reasons. So then, whenever one is coming, and there is an opportunity in which a person who is coming from a suburb or coming from a background in which they are not knowing about these things. It is our duty as a pediatrician also to tell them, okay, there are certain things which are very important to be taken care of, and there are certain vaccinations beyond this which has to be done. So I would say awareness in the cities and tier 3 cities are more, and the awareness in the tier 1 and tier 2 cities must be and villages must be less.
Yes.
But if you extrapolate the all these issues in terms of the transmission, in terms of the number of cases detected in India because of hepatitis A vaccines and the hepatic failures and everything, then we know it becomes a very important thing on a large scale and a mass scale. So awareness is lacking, no doubt about it. Awareness is slightly in the cities who have the educated population.
Okay. So, like after the session, what are the preventive strategies you will suggest to the parents? Like immediately they should follow.
See, the thing is, we know that the vaccination can be given at an early age, which is 1 year.
Yeah.
This is the guidelines. You first dose, you get dose after 6 to 18 months after the first dose, and we know that the protection value is as high as 99%. So, thing is,
Yeah.
once you are aware, okay, that there is one vaccine preventable disease in which the vaccination itself does not cause a lot of side effects. They are the side effects due to the
Yeah.
vaccination as are as low as maybe only the soreness in the arm, not even causing a fever. So among the
True.
hundreds and thousands of kids we have vaccinated, we don't see major side effects out of the hepatitis A vaccine.
Yeah.
So once there is a disease which has a potential to cause as complication as a hepatic failure, which can be transmitted to adolescents and adults, in which the severity even worsens, then
Yeah.
to vaccinate the child at an appropriate age so as to prevent the transmission, increase the endemicity. Of course, that is the first thing. So go back home, see the vaccination card, see if your kid is more than 1 year of age, whether he is vaccinated or not. If not done, the catch up vaccination can be done even between the age of 2 to 18 years.
Yeah.
Okay, and then this is one. Second thing is, and this goes on as a common counseling for all the toddlers, that teach the children about the hand hygiene techniques, tell them how to take care of the overall hygiene in terms of the sanitization as well. Potty train at them at a appropriate age so that it is not delayed and then does not become one of the reasons for the hepatitis A virus. And something which is a very basic teaching which all of the parents should be doing to their kids.
Definitely, sir. You have wonderfully framed it. And I think so that will be a good takeaway message also. So basically, hand hygiene, vaccination are the two preventable things which they should follow.
Yeah.
Sir. So I would just take the comments, sir. One parent have commented like hepatitis A disease, we have missed it. So like they, I think so, they have missed, but they wanted to take it. So can they take it?
Yeah. So first of all, the thing is, what is the age group of the child? Okay.
So
Second
they have
is,
not written. Yeah.
sorry, come again.
Please go ahead, sir. Please go ahead.
Yeah. So once we know if see the catch-up vaccination can be done actually at any age, but normally what happens is that there is a protocol that if the child is more than 10 years of age, so we can go for the sero positivity in terms of the blood check and see what is the sero positivity of the kid. If the kid is already immune because of the natural exposure and they have the proper sero antibodies, so these kids or these adolescents or these adults do not need the vaccination as such.
Yeah.
And these tests are available in the common laboratories as well. So if it is less than 10, they can go ahead with the vaccination, two dose schedule, one at 0 months and then after 6 to 18 months. If they are more than 10 years of age, you should go for a serological analysis of the blood sample to see the seropositivity. And if it is seropositive, then they do not get the vaccine.
Yes, sir. So I think so that was it, sir. So thank you for all being a part of Immunize Talks. We hope that today's session was informative and valuable in spreading awareness on, as our topic says, hepatitis A in children and what parents should know. Special thanks to Doctor. Thank you so much, sir.
Thank you.
So for your
Thank
sharing
you,
your
Dr.
time, expertise, and insight with us today. So, for those who would like to revisit the program, the video will be available on our official media platforms. And please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word to as many as including your friends, family, and relatives. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. So, I again thank Doctor. Thank you for your time.
Thank you. Thank you.
Thank you so much.